So if you're only missing one tooth, why a dental implant over a traditional bridge?
Okay.
That are proven.
Very simple. To do a traditional bridge, you have to take the teeth on either side where the tooth is missing and damage those teeth. A lot of times those teeth are what you call virgin teeth. They don't have anything wrong. No fillings, no anything. So to imagine taking your tooth and cutting it down to a little stub, because you need that for the crown to fit over. So if you're missing this tooth and you're going to do a traditional bridge, you crown this tooth and this tooth, cut them to little stubs. Well, you've accelerated now the destruction of the tooth by years.
Okay.
Then on top of that, because you're using two teeth to hold the middle one, even in the toughest of material you're using, zirconia or porcelain or whatever, you have to have the amount of bulk that holds onto those teeth so the middle part doesn't break off.
Okay.
So a lot of times, like you see how your gum comes between your teeth, we call that the papilla. Okay. So when you make those bridges, a lot of times, you have to make where the two teeth touch and then goes out, how the gum goes like that. That is too big and it makes that gum point fade or fall in. So it looks fake.
Okay.
Now with a single tooth implant, you're not touching the other teeth.
Just put it in and that's it.
And I was a pioneer. I've got 40 clinical papers about this. Tooth removal, implant placement, attachment goes on, and temporary crown that day, and grafting, whatever else is done that day. And many times, even without sutures. So we call it minimally invasive, immediate tooth.
So it's a lot less expensive in the long run to just get a tooth back with a dental implant rather than a bridge.
Dollar cost average over many years, much more expensive. Much less expensive, I'm sorry.
One of your family members were of the age, let's say, and they were only missing one tooth, and they're of the age implant. Would you always do an implant over a bridge?
100%, absolutely. We don't do bridges. We don't do any bridges in our practice, nothing. Yes.
You think bridges are old-fashioned? I don't want to put words in your mouth. But
I don't want to categorize. I think that bridges, okay, or because some implant restorations are bridges.
Okay.
Which is okay. I think that a conventional bridge on a tooth or teeth that have nothing wrong with them, the adjacent teeth, is totally contraindicated in today's day and age. I think if a patient was missing a tooth and they had some old crowns on those teeth on either side, a bridge is an option.
Okay.
But it's going to be better treated with an implant. But I don't want to make sure. I don't want to.
So if you're going to do bridges, make sure they're supported by dental implants.
Yes, would be the best long-term solution that will hold up the. Dental implants don't get cavities. They don't get root canals. They can still have other issues develop around the gum tissue, like teeth do, because they're still in the teeth and gums.
I had a medical doctor on the show, sat right where you were sitting. He was talking about dental implants. He got one implant, no tooth on it. Says they're going to do it in 6 months. And after talking to you, you say that you do it the same day.
That's conventional. The way he's talking about is conventional. You do not leave our practice without on a single implant or two implants, without a fixed aesthetic.
So that's just the training of the doctor then that's putting...
Expertise training, yes.
Okay.
Yeah.
So you do it in one day?
Yes. Yes. For the better part of 20 years, I've been provisionalizing implants and being able to go to final crowns in a fraction of the time that's normally done.
What about pain? I mean, it seems painful.
We're doing it atraumatically. No incisions, no sutures, none of this stuff. So the amount of pain is, people think that removing a tooth is where the pain comes. It's not true. When most people have dental pain after a tooth is removed, it's what's done around it.
The gums.
The incision, the gum, the taking bone away. That's where the discomfort comes in. The actual removal of the tooth, if done atraumatically, is minuscule as far as discomfort is concerned.